Hello, my name is Brianna Wethington, and today we will be talking about disulfiram, also known as antabuse. So what studies have shown is that some individuals carry a gene that causes a slower metabolism of acetaldehyde. This slower metabolism leads to a buildup of acetaldehyde, increasing the risk of adverse effects. What this means is that some people drink, their liver takes a longer and harder beating, leaving them with a big hangover effect. Normally looking like this though. So what modern medicine has done is create a drug that mimics this process, and they use it as an adjunct to maintain sobriety and treatment of chronic alcoholism. And they call it disulfiram. So disulfiram is a thiopurine derivative. Thiopurine is found in a lot of pesticides and germicides. Its purpose is to stop unwanted things from coming around. And in this case, the unwanted pest is acetaldehyde dehydrogenase. So first you ingest your alcohol, and it's broken down by the liver by an enzyme called ADH, but not this ADH. Instead, it's called alcohol dehydrogenase, which is a toxic enzyme that turns alcohol into acetaldehyde, which acetaldehyde is found in a lot of ripe fruits and brewer's yeast. So we're gonna represent it with an angry looking apple. From there, acetaldehyde is turned into acetate by acetaldehyde dehydrogenase. But what disulfiram does is interrupt this process, stopping the party. So when disulfiram interferes, it increases the blood acetaldehyde level 5 to 10 times the normal level, but it only does this if you ingest alcohol. So what this means is an individual who consumes alcohol while taking disulfiram will experience hangover symptoms that include angina, anxiety, blurred vision, confusion, throbbing headache, throbbing in the neck, vertigo, vomiting, weakness, diaphoresis, dyspnea, heart failure, hypertension, nausea, palpitations, sinus tachycardia, syncope, and thirst. These symptoms are normally severe and last 30 minutes to several hours, followed by a deep sleep. Some adverse effects of disulfiram include drowsiness, headache, peripheral neuropathy, psychotic reaction, tiredness, blurred vision, garlic or metallic taste, optic atrophy, optic neuritis, impotence, and rash. The initial dosage of disulfiram is up to 500 milligrams daily for 1 to 2 weeks. To maintain a therapeutic level, a patient is prescribed 125 to 500 milligrams daily with a max dose of 500 milligrams daily. It's important to tell the patient that consumption of 3 or more alcoholic beverages with a disulfiram dose of greater than 500 milligrams daily may cause respiratory depression, arrhythmias, and cardiac arrest, and never give to patients who are intoxicated or have consumed alcohol within the past 40 days or 14 days. Some contraindications include alcohol intoxication, coronary artery occlusion, hypersensitivity to disulfiram, rubber, pesticides, psychosis, recent use of alcohol, alcohol-containing preparations, metronidazole, formaldehyde, and severe myocardial disease. Some nursing considerations is only give disulfiram to highly motivated patients who are receiving psychotherapy or substance abuse counseling and are ready to truly stop drinking. And know the alcohol content of the patient's other medications should be checked before starting therapy. Be aware of possible interactions with CNS depressants, phenytoin, tricyclic antidepressants, and caffeine. And you should teach the patient that alcohol ingestion may continue to produce unpleasant symptoms for up to 2 weeks after therapy stops. Expect therapy to last months to years. Avoid alcohol-containing substances such as cough syrup, sauces, vinegar, hand sanitizer, and mouthwash. And it's important to remember that disulfiram does not cure alcoholism, but it does help deter alcohol consumption. And that concludes my presentation.